The COVID vaccine's deadly disparity. Access to life-saving jabs are deepening the divide between rich and poor countries. Should wealthy nations carry a heavier load for preventing the spread of the virus? I'm Andrea Sankey, and this is The Newsmakers. The World Health Organization says giving booster shots to people who are already fully vaccinated is like handing out extra life jackets to people already wearing one while leaving others without them to drown. Still, the campaign to deliver third jabs in developed countries is on. Health officials in the U.S. are recommending boosters for all adults who received the Pfizer or Moderna vaccine beginning in mid-September. And the UK's vaccine watchdog is set to decide which vulnerable groups should get a booster shot, although a general rollout of third shots looks unlikely. The reason for boosters has to do with the diminishing effects of the vaccine. In Israel, for example, more than half of all new infections there are occurring in fully vaccinated people. But the data is still inconclusive about whether booster shots are even effective. And should we be even talking about third jabs when most of the world remains unvaccinated? Now, nearly 4.8 billion doses have been administered globally, leaving just over 15% of the world's population fully vaccinated. In the UK and the US, more than half the adult population has had both shots, but in Haiti and Congo, less than 0.1% of adults are fully vaccinated against the virus. Malta, the UAE, and Singapore lead the world in fully vaccinated populations, but no one in Kuwait, Libya, or Afghanistan have received a second dose. The majority of jabs went to people living in wealthy countries, whereas only 0.3% went to those in poor countries. There's also a sharp divide between continents, with Africa having the slowest overall vaccination rate of any continent and Europe having the highest. And with almost 85% of the world's population still unvaccinated, not being able to provide proof of vaccination could get you barred from hopping on an airplane or eating in a restaurant, which is already happening in Israel and Russia. Issues around vaccine inequality, privacy, stolen or forged passports, as well as the lack of common standards and infrastructure, has turned what seems like a smart solution into a problem. Natalie Pohonen explains how vaccine passports will work and who loses out by not having one.
Heading to the airport and jetting away has seemed like a distant dream during the pandemic. For some of us, it's now turning into a reality. But there's a big change coming to how we'll get around in this COVID-19 world, because to check in, it's likely we'll need to show proof of vaccination. That's where vaccine passports come into the picture. Like a regular passport, it'll be a form of ID with your name, birth date, and crucially, data about your vaccination status. In some cases, this will be in a digital form, accessed through a QR code. You might need to show it not only to head overseas, but perhaps even to go to a concert, football game, or a festival. But needing to prove your vaccination status to enter a country isn't new. Some nations require travellers to have a yellow fever vaccine before they're allowed in, and those details are recorded in internationally recognised booklets that look like this. Right now, there's no global standard for a COVID-19 vaccine passport, so some parts of the world are going ahead and creating their own versions. From July, the EU's digital COVID certificate system will go live across the bloc. It will contain health information that's uploaded by member states and will show proof of one of three things. Either you've been vaccinated, returned a negative PCR test, or recovered from COVID-19. The EU hopes these digital passes will help cross-border tourism and trade. While getting vaccinated might not be mandatory, proof that you have had your jabs does come with incentives beyond your health. EU member Lithuania launched its own version of a certificate in May called the Freedom ID. It can be used to get around restrictions on attending cultural events or indoor dining.
What is most important probably is that we have to encourage people to get their vaccine. And this is an incentive for those who are not yet got their vaccine to get vaccinated.
But there are concerns that requiring proof of a jab could create two classes of people: those who've had access to shots and taken them, and those who haven't. And while vaccination campaigns have rolled out in many countries, particularly in the West, in other parts of the world, people are still waiting for doses to arrive. Which means that for millions of people right now, a vaccine passport is simply out of reach, along with any of the benefits that come with proving their vaccine status. Natalie Perhanen, The Newsmakers.
Well, last year, the International Health Alliance, COVAX, announced that it made deals with vaccine manufacturers to help less wealthy countries access billions of doses. And they promised to redistribute the oversupply wealthy countries amassed to poor nations. But in late June alone, 530,000 doses went to Britain, more than double the amount sent to the entire African continent in the same month. Canada, Australia, and New Zealand also received doses through COVAX. Joining me now to discuss this disparity and what can be done to change it is Dr. Annelies Wilder-Smith from Lucerne, Switzerland. She's a professor of emerging infectious diseases at the London School of Hygiene and Tropical Medicine. She's also a consultant to the World Health Organization. From Perth, Australia, we have Dr. Archie Clements. He's a professor of health sciences at Curtin University. And in Bath, in the United Kingdom, is senior clinical lecturer at University of Exeter Medical School, Dr. Bharat Pankhania. Thanks all so much for being with us. Annelies Wilder-Smith, let's start with actually looking at the United States in particular. That's the world's wealthiest country, now starting to register citizens for third shots. From what I understand, you have an issue with the timing, in that right now it hasn't been shown that it's necessary or even effective, really, to start with boosters, especially at the cost of not providing people in poorer countries with even a first dose. Is that correct?
So the current main objective is to prevent deaths globally. And to do so, we need first dose coverage to be high globally in every country. So that's why the first objective is to ensure that all countries receive a high vaccine coverage before we start thinking about a third dose.
Okay, but let me ask you quickly. I mean, is there a lack of trust right now in the science that, I don't know, could be somewhat justified because, for example, initially, masks weren't believed to provide much protection. Now they're actually mandated in most cases. And today we're hearing that, there isn't really enough proof that a third shot provides necessary protection, but that's not to say the science won't prove that later.
You're correct. So we need to monitor vaccine performance over time. And it's very likely that, and as many other vaccines do as well, that the vaccine effectiveness may decline over time. For many other vaccines, we do need more than 2 doses. So, for example, hepatitis B is a 3-dose schedule, tetanus is 3+ doses, polio also many more doses. So it would not be unsurprising that we would need a third dose. It's more about the right timing. And that's here the issue. So we are monitoring, the world is monitoring vaccine effectiveness over time and against variants and in specific subpopulations like older people, persons with immune suppressed conditions.
Okay, Bharat Pankhania, let me turn to you. If it is about the timing and the priority should be to prevent deaths globally, I think one of the issue is, and we have to be brutally honest here, with national economies really devastated around the world, leaders are going to be looking to protect their own. And they will justify that protection by saying, for example, that the U.S. economy is a global engine. So our productivity is simply more important. And if booster shots ensure that we maintain our productivity, we're going to keep the vaccines to ourselves and we're going to start administering booster shots.
Andrea, that would be such incorrect thinking, because we are not well until and unless the rest of the world is well too. And to have fully immunized with 2 doses is pretty good protection Furthermore, the evidence for the need for, at this point in time, as my colleague Annelies has said, a third booster dose is 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 not as important as gathering our energies and giving the vaccines to other parts of the world that need it. Remember, America cannot exist on its own. America trades and sells things to the rest of the world. And therefore, their thinking should be, we are well, but we need to make the rest of the world well too, and enable them to have the vaccines. On that subject, I really do applaud President Joe Biden, who has taken over from President Trump, who I thought has got a lot to answer for all the deaths that America has had and all the mismanagement. Now, President Joe Biden has said we need to relax for the purpose of the pandemic, the patent laws, and enable the manufacture of these vaccines at scale in different regions of the world so that we can all be immunized as fast as possible. And I think that is a good thing to do, except the European Union, United Kingdom, Sweden, and Australia have been objecting to this.
Okay, Archie Clements, let me get you in on the discussion because I'm really trying to play devil's advocate here. I'm going to imagine that you agree with both opinions you just heard. But unfortunately, people do act selfishly, especially when it comes to times of crisis like this. We just saw 4 years of America First policy in the United States, and Joe Biden, I appreciate that Dr. Pankhania likes what he's hearing from him. In some ways, people say he is looking to maintain this America First policy. And if protecting Americans means that the American economy can recover at the cost of poor nations that America might not have much interest in trading with or interacting with anyway, then they're going to put America first still.
Yeah, but unfortunately, as the previous speakers have said, you can't put America first if you don't tackle problems around the world. So it would be a totally false economy to suggest that by keeping island America safe or fortress America safe is somehow going to support the global economy. The longer that the pandemic goes on around the world, the greater the probability is that new variants will emerge that are more transmissible and that potentially could be less well controlled by the existing vaccines that we have available to us now. So the absolute priority has to be getting on top of the pandemic everywhere. Professor Vilda Smith mentioned the fact that the current major objective is morbidity and mortality control, so preventing people from getting sick and dying. But I also believe that the vaccines are a really important means of impacting on transmission, even with a highly transmissible strain.
Okay, Dr. Vilda Smith, though, let me put it to you this way. I mean, haven't we effectively missed that window of opportunity to stop COVID in its tracks? Because the vaccine rollout, it's failed. It really has. It wasn't equally distributed fast enough. And there are still too many millions of people who are vaccine hesitant or, fully vaccine resistant. They're just not going to get it. There are millions of them, and the world is going to have to allow them that choice. So providing equal distribution is kind of thrown out the window when so many millions still won't take it.
You're right, but I would be a little bit more positive. I think the vaccine rollout was a success. It's an historic record in pace and scale, how we rolled out this vaccine to the entire population. We have now administered 4.7 billion doses, all within a matter of 6 to 8 months. That's an incredible success story. Where we failed was in the equitable distribution. And that is not really a failure of COVAX. The mandate and the aspiration of COVAX was an equitable distribution. It failed because the rich countries went onto their own bilateral agreements and negotiations with the companies, and thereby drew a lot of the vaccine supply to them. I can only repeat one thing. We are still at a time of limited vaccine supply. We know that vaccine supply will increase, and we do expect by 2022 we will have a lot of vaccine supply. So it's now about ramping up further to 2022. And the biggest impact remains high coverage with the first dose, then second dose, and then only then start thinking about a third dose.
Right, I get
Sure.
that, and I know most everyone will agree on that. But the truth is, developed nations will, in many ways, continue to represent their own somewhat selfish interests. These booster campaigns are going to go ahead. So, I mean, I don't know. Do we have to start looking at a different balance here, not just getting vaccines to more people, but prioritizing where people will be most exposed and what, economic and social fallout it could have? Annelies, go ahead, because I know your time is actually limited with us.
No, I must also correct something. The US will first only give the third dose to the high-risk populations. That means those that are immune compromised. The rollout as a third dose in the US has not been fully decided yet. It has not gone through the ACIP committees, etc., and has not, the policy recommendation has not yet been done. In Israel, that is indeed the country where the third dose is being given to the entire population older than a certain age group, also starting with a WHO priority list. That means older ages first, those with comorbidities first, those who are more vulnerable first, and the healthcare workers who have a high exposure and therefore are at high risk.
Okay. Bharat Pankhania, I'm going to turn to you, and if you can be as brutally honest as possible, I want you to tell us who really is the most guilty of wasting or hoarding, and then who is genuinely seeing the most suffering as a result, and how might we all pay a serious price for that?
Several questions here. And whilst we were having this discussion, I was thinking in my own mind, I think the pharmaceutical companies have had public funding to do the experiments, invent the vaccines, and be successful. And they need not forget that they owe it to the public, the entire public, not necessarily the country in which they are located. Now, they took in orders. They took in orders from the rich nations and filled their order books to the brim. They have no more capacity to make any vaccines for Africa in 2021. I think that is a disgrace. They should have said, hold on a minute, we need to have capacity to make vaccines, and if need be, we will give it free of charge to the other countries, because they do know the epidemiology of vaccines. And if you only immunize the richer nations, it won't work. As our colleague from Australia has said, you will get the emergence of variants from countries where you haven't had the vaccines, and those variants could nullify our vaccine program. So it isn't in our interest, and the pharmaceutical companies should have held back and said, there is only so much we're going to sell to you, and the others we need to keep in reserve for Africa, for Asia, for South America.
Okay. I mean, you're all three presenting incredibly strong arguments. I'm going to continue to play devil's advocate, though, because this is where some leaders of wealthy countries will be coming from. And there are arguments, about right now, again, who is fueling the global economy, which is equally important, they believe, for protecting lives. Not least, Archie Clements, I'll ask you, who's traveling? Travel and tourism being a crucial sector. And if vaccine inequality means vaccinating those who travel and keep that sector afloat with its millions of jobs and crucial livelihoods, is that such a bad thing?
Well, I just have to reiterate what I said earlier. I think it's a false economy. You can't separate one jurisdiction or one part of the economy from everything else. So,
but let me push you on that. Are you sure that's not the case? Because as countries become more and more insular around the world, as we've seen, and now with travel bans that we're sadly becoming accustomed to, why can't they argue that we can isolate ourselves and that we can only deal with we can narrow it down to dealing with the economies of other rich countries and protect our own interests that way?
Because that only works for a certain period of time. You can't do that forever. Social cohesion, social buy-in to these sort of very restrictive public health measures only have a certain degree of longevity. They can't continue forever. So, eventually, if we don't get on top of the pandemic, the social and political pressure will be such that these public health measures will start to fail. So, it's just a false argument that we can't buy. We're all in this together. I understand why governments may be primarily motivated by domestic political factors like like successful rollout of vaccines and what that means for them politically. But at the end of the day, that's a short-sighted strategy, because people in every jurisdiction around the world are vulnerable if the pandemic everywhere in the world isn't under control.
Right. I guess it's just,
Yes.
the example that's been set by some already, when we know for a fact that, I mean, vaccines at such a crucial time when the initial rollout began, vaccines were thrown in the garbage because they were expiring. There were too many to even distribute at a time. And if that was kind of the example set and there was no punitive action taken for that, it's worrisome to think how it might go forward if another variant starts to develop, and we'll see that same kind of selfishness and lack of vision set in again. Annelies, I want to ask you, though, I'm glad we still have you. Let me turn to Annelies quickly, because another issue here is that this vaccine inequality actually just, mirrors the world's general inequality. When we look at poverty rates and, access to health care and education, doesn't that worry you that that's kind of the example we see on our planet in general?
Yes.
Well, that's a very far-reaching question, and would require hours and hours of work. We all have to deal and tackle the inequalities that we have, and I must say, COVAX is an example, a positive example, how we had the vision early on. COVAX started very early to counter the existing inequalities. I must also say, there are two sides to the story. It's not only about shipping vaccines to countries. Countries must be prepared to roll out and deploy the vaccines. That means they have to have the personnel, the training, the cold chain, the fridges, the regulatory approvals around it to do so. And for some countries, that took longer than for others. So I think we need to bring up all the countries, also in terms of tech transfer, but also in terms of just vaccination logistics, programmatic issues, so that they can all deliver. Remember, giving COVID vaccine is not part of your normal routine vaccine rollout that you do for children. Here we are first targeting older persons. Hardly any country has experience in vaccinating older persons first. So there's a lot to learn, and we need to learn together. And COVAX is the mechanism shared by global leaders, also in terms of finances. And the US is paying a lot of money to COVAX now with Trump, with Biden. So
Right.
I think there's some progress.
It is frustrating, though, to see that, your scientists and doctors like yourselves are still, fighting to convince people and leaders in wealthy countries that they're going to have to seemingly kind of sacrifice something for the greater good, because they are arguing that they are the greater good. Bharat Pankhania, if you can comment on that.
Well, it is imperative that leaders rise up to the podium and do the necessary things, which is share their vaccines and share them across the globe. And I am also aware that in Africa, for example, the leaders have been quiet about promoting vaccines. And the reason they are quiet is because they failed to secure any supplies of vaccines. And therefore, what is the point of promoting it if you've got no vaccines? So yes, we need leaders in the United Kingdom, European Union, USA to share the vaccines and enable vaccine production, and leaders in Africa and Asia, where there is none, to step up and promote the uptake of vaccines when they become available. And I appreciate that in 2022, more vaccines will become available, but the work starts now in gearing up to administer those vaccines.
Right. Administer the uptake as well as get that manufacturing started in developing countries.
Yes.
So that, wider production can lead to greater vaccination campaigns. Okay, we're going to have to leave it there. Bharat Pankhania, I'm going to have to give you the last word. I'd like to thank all three of my panelists so much for being with us, and our viewers, of course, for being with us as well. Thanks for watching. Remember, you can follow us on Twitter @_newsmakers. Let us know what you think. We'd love to hear your comments, and we'll see you next time.